Hi there, everyone. Thank you for joining me today. I am coming to you from Gadigal country, and my name is Sarah Hunstead. I'm a paediatric nurse, mum of two, and founder of CPR Kids. And to those of you who joined last week, I attempted to show you CPR for babies, but the power went out and the internet, and of course the internet went out too. And so that got stuck pretty much halfway through, and it didn't come on again for ages. So I'm going to redo that again today. So we will learn about CPR for babies. And I just want to thank Mudge and Gal for having me again today. Thank you so much. And really looking forward to next week as well, where I talk about CPR for children. So today we're talking about CPR for babies age 0 to 12 months. And next week I'll do CPR for kids age 1 to 8 years. So now, at the moment, I am in lockdown at home, so there may be a child or a dog or somebody else who walks in not realizing that I'm doing this, even though I have told them that I am doing a Facebook Live right now. So, you know, we may have to stop for some reason, but hopefully the internet connection will stay stable this time. And what I'd love you to do is that if you can tag anyone in the comments below who needs this refresher. So the way that I'm going to do this today is in our CPR Kids classes, we usually take, around 90 minutes to teach you CPR. Not going to do that today. I'm going to step you through a refresher. If you haven't done CPR before, then what I want you to do is make sure that you book in. Obviously, if you're in lockdown now, it's a bit tricky to get to a class, but you can book ahead to do a baby and child first aid class, because it's really important that you do get the hands-on practice, whether it's with us, whether it's with another provider, whatever. It's just about making sure you get that hands-on practice, okay? So we are going to go through Doctors ABC today, ABCD, I should say, and I hope that this is a really good refresher for you, and that if you haven't done it before, that it prompts you to go ahead and actually go and do a first aid class. So let's start. First of all, you need to remember that CPR is not about bringing somebody back to life, okay? It's not in the movies what you see where, somebody starts pressing on someone's chest and then all of a sudden they wake up and they're fine. It's not usually how it works, okay? So your job is to press hard and fast on their chest to circulate blood and therefore oxygen around the body, primarily to the brain, so that if the cause of them, needing CPR, if their heart becoming ineffective, their breathing becoming ineffective, so if the cause of that can be fixed, you've given them the best chance possible at a good outcome. And that's what's really important. So you are the pump. That is your job. You are the pump. It's not your job to fix what's gone wrong. It's not your job to make them miraculously wake up again. It is simply your job to be the pump and circulate that blood and therefore oxygen primarily to their brain. That's what CPR is about, okay? So don't worry if they're not waking up. So now we know what CPR is actually for. Let's get into Doctors ABCD. So that's D, R, S, A, B, C, D. D for danger, R for response, S for sending for help, A for clearing and opening the airway, B for breathing, C for CPR or compressions, and D for defibrillator. So we're going to go through each of these systematically, and then we'll put the whole lot together, and I'll show you on my baby Annie here how we're going to do it. Okay, so first of all, D for danger. You need to make sure that you are safe, Bubby's safe, and those around you are safe, okay? Because if you are hurt, you cannot help your baby. So you need to make sure that you are safe to go and help them. If they are in danger where they are, move them out of the way of that danger. If it is a greater danger, if they could, for example, they're in the middle of a road with semi-trailers coming down and things like that, they're in great danger where they are. You're going to need to move them. So make sure that you are safe and they are safe, all right? So once we've checked for danger, we've established that there's no danger, that we can go ahead. Then the next thing we're going to do is check for response. We want to know if they are conscious or unconscious, because if they are conscious, they might be really sick They might need an ambulance coming, lights and sirens, but they do not need you pressing on their chest. And that's a really important thing, okay? So we're going to pick up Bub, if it's safe to do so. We're going to hold them upright in our arms, and we're going to give them a good tickle. Annie, Annie, open your eyes, Annie. Feet, hands, Annie, Annie, open your eyes. And hopefully she's giving us a nice big cry, because if she can cry, she doesn't need CPR. That is a good thing. So when it comes to babies, sorry, just a little bit of noise here from because everybody's doing school from home here as well. So we're all in the one room at the moment, and their kids are being really, really good trying to be quiet for mum while I do this, but it's all good. So where was I? That's right. So what we expect, if the baby is crying, they can breathe. That is great. They don't need you pressing on their chest. But if they are conscious, fantastic, we still may need help coming. But if they are unconscious, so when we pick them up, we do this, they're not responding, they're heavy, they're floppy, they're not making purposeful movements, then what we're going to do is we will then move on to the next step. So if they are unconscious, we move on to the next step, which is sending for help. The number that we call is 000. I encourage you to download the Emergency Plus app, which I'll put a link to down below as well. And you can have a look at that, because sometimes we don't know exactly where we are, because you need to tell emergency services clearly and calmly where you are and what is wrong. Okay, so these are the things that you need, and you need to answer their questions and not hang up, because they can talk you through what you need to do at home while you're waiting for the ambulance, okay? But the Emergency Plus app, sometimes we don't know the exact address of where we are. And so what it does is it gives you the latitude and longitude of where you are, and it also uses what 3 words. And I'll let you explore that when you download the app onto your smartphone, but I will put the link down below in the comments for you as well. So we have so far checked for danger to make sure that we are safe, they are safe, and those around us are safe. We have checked for response to see if they are conscious or unconscious. If they are unconscious, we are moving to the next step. And so that is sending for help. So if we don't have a phone with us, if there is somebody else available, get them to call for help. And of course, make sure that ambulance can get to you. If you need to, you scoop Bub and you run outside. You can be doing CPR on the nature strip while you flag down a car. You get help any way that you can, but without delaying CPR, okay? So sending for help. Next, we are going to clear and open the airway. Now, your airway is the tube that goes from your nose and mouth down into your lungs. And the important thing there is that when we become unconscious, we lose all the protection that keeps our airway open. So therefore, we need to open their airway for them because they are unconscious. And babies have huge heads, let's face it. So what happens is when their big head, when they become unconscious, they fall forward, they fall to the side, and their airway kinks off like a straw. Now, all of this is protected when they are regularly sleeping, so you don't need to worry when they are healthy and sleeping. That's absolutely fine, okay? So, but this is different. They are unconscious due to illness or injury. So they've lost that protection and their airway can be blocked off. So here's what we're going to do. So first of all, we are going to look in their mouth. If they have vomit or carrots or Lego or anything like that in there, then we are going to roll them onto the side and gently front of the mouth, we can wipe that away. If you can easily just pluck that, lollipop or, whatever it is, or that leaf that's hanging out of their mouth, do it. But what we are not doing is a big finger sweep, because we can push whatever it is further down and we don't want to do that, okay? So just the front of the mouth, let that drain out and then roll them back. So we've cleared the airway. Mind you, if you look in their mouth and it looks clear, that's fine. You skip this step. You don't need to do it, all right? So I've looked in their mouth. It's now clear. The next thing I'm going to do is I'm going to put their head into what we call a neutral position. So what we are doing here is we are opening the airway. So their head will be all floppy like this. We're going to put our non-dominant hand on top of their forehead with our thumb and forefinger. We're going to hold them on just that hard part of the chin, and we're going to tip their head back until they're nice and straight. So in a grown-up or an older child or a child, we would tip their head back, but we don't do that in a baby, okay? We just put them in that nice, straight, neutral position, and we lift their chin upwards towards the ceiling. So there we go. So we're like this, and we come along and we open up, okay? And while we're doing that, we're going to go on to the next step, which is checking for breathing, okay? So I'm going to get down nice and close, my cheek nice and close, while I continue to open up and hold the airway. And I'm going to look, listen, and feel. I'm looking for rise and fall of the tummy in a bub, okay? I'm listening for air coming out, and I'm feeling with my cheek. And I'm also looking at their color. So no matter what color skin your baby has, if they need CPR, they will have had a color change, okay? You know what is normal for your bub. You will notice that they may start to turn blue. They may start to become splotchy, like marbled. We call it mottled. You may start to notice that they particularly become initially quite pale, and then they start to turn that blue color. And if your child has got really dark skin, you'll start to notice that blue color on their gums, inside of their lips, in here under the eyes, where that is just here. And so that's what you'll start to see, okay? So, but no matter what color skin your child has, you will notice, because it will be different to normal, okay? So we're going to look, listen, feel for up to 10 seconds. So looking for rise and fall of the tummy, listening for air coming out, and feeling with our cheeks. And we're not looking for a complete absence of breathing. We're looking for abnormal breathing. So they might be going, that's not normal. And the dog doesn't think it's normal either, actually. Thank you very much. How about you sit here so I can still continue to teach this? Lay down. Come on, lay down. There we go. Yeah, she wasn't too keen on my breathing then. Sit down. Come on, sit down. Sit down. There we go. She's just a puppy, so let's see if she will actually listen to me. So let's recap while we're at it. That was a good opportunity to recap. Thank you very much, Molly. So first of all, D for danger. We want to make sure that we are safe, they are safe, and those around us are safe. Next is R for response. We want to know, are they conscious or unconscious? Next, thank you, Molly, is that we want to send for help. We want to make sure that ambulance is coming. So don't hang up, stay on the phone, answer their questions, follow their directions. And if somebody else is with you, then by all means get them to call for help, okay? So we've sent for help. Next, we are going to clear and open the airway. So if there's something there, vomit, Lego carrots, anything like that, we're going to simply wipe and then roll them back. And then above, we are going to put in what we call the neutral position. So remember, we're going to tip their head until they're nice and straight, and we're going to lift their chin towards the sky, okay? Next thing, we are going to check for breathing. We're going to look, listen, and feel. So we're looking for rise and fall of the tummy. We are listening for air coming out. We're feeling with our cheeks, and we are looking for abnormal breathing. So if their breathing is either absent or abnormal and they are unconscious, we're starting CPR. It's that simple, because CPR is not about a heart that's stopped. It might be, but it's really about a heart that is not doing its job properly, okay? Might be fluttering around, it might be beating too slowly. So what it's about is a heart and breathing that's just not doing its job, okay? So that's why we're not going to feel for a pulse or anything like that. If they are unconscious with absent or abnormal breathing, we are getting on their chest and we are starting CPR, okay? So how do we do that? What we're going to do, we're going to make sure that they're on a hard surface, so preferably the floor, okay? we're going to get their clothes off so that we can see their chest. All right. And with 2 fingers, we are going to place that on the center of their chest. And there's a really good way to do this on a baby. Do you see their nipples? Trace that into the center and just put your 2 fingers just below there, okay? You should feel their breastbone underneath. So if it's squishy, that's tummy. It's too low. Too far up, we won't be able to press the chest, but 2 fingers just below that nipple line on that hard breastbone. So feel on yourself. You should feel that hard breastbone, then go down lower. Stomach squishy, no good, okay? So on that hard breastbone. 2 fingers, we are going to push down 1/3 the depth of the chest. So that's the depth. We want to push down 1/3 of that. I'll just move back a little bit so you can see my baby better. There we go. So 1/3. How fast do we go? There are some great songs. Baby Shark works. So does Staying Alive by the Bee Gees. And so the rate is around 100 to 120 compressions a minute. Okay, so that's almost to a second. So it's pretty fast. And what we're going to do is a ratio. We are going to do 30 compressions to 2 breaths. Okay, so the way that we're going to do breaths is we're going to put our mouth over their mouth and nose, and you simply do that until they're too big for you to comfortably get a good seal. If your baby is too big for you to put your mouth over their mouth and nose, just pinch off their nose and put your mouth over their mouth. Okay, so that's what we're going to do. So I'm going to demonstrate a couple of compressions, I'm going to demonstrate a couple of breaths, and then I'm going to do some cycles of CPR to show you. If you have a teddy bear or a pillow or anything like that at home, grab it now, and then you can come and learn with me. All right. So first of all, this is what a compression looks like. Okay. You can see that it is quite deep. It is 1/3 the depth of the chest. All right. And you can see that, did you notice that I did this? Okay. It's not my arm kind of coming back and doing some compressions like this, because my arm is going to get really tired. I'm going to lift up, and it is my body that is doing the work. You can see that it's these big muscles that are actually doing the work with the compressions. Now, ideally, use your 2 fingers. If that doesn't work for you, you achieve this any way that you can. You can use 2 thumbs if you want to. You can use 2 fingers. You do whatever you need to do to achieve 1/3 the depth of the chest. But just what I don't want you to do is push on the side of the chest, okay? We've got to be up, over the top, and pressing down, okay? So what about the breaths? When we give our breaths, we must open the airway. Good seal over the nose and mouth, and we're going to give 2 breaths. So watch. Like that. Okay, so that's what we're going to do. Now, 2 breaths, all right? So did you notice that I took my mouth off in between the breaths? Okay, so even if your breaths don't work, so you don't see the chest rise or anything like that, don't go back and say, oh, I better give 4. No, we do 2 attempts at breath, and then we go back into our compressions. So this is what it's going to look like. We're going to put it all together. Okay, so first of all, we check for danger. We make sure we are safe, they are safe, and those around us are safe. Next, we check for response. Annie, open your eyes, Annie, open your eyes. Hopefully, she's giving us a nice big cry. If she doesn't, if she is heavy and floppy in our arms and she is not making purposeful movements or purposeful noises, then we are going to move on to the next step. We're going to send for help. You're going to call 000, follow their instructions, stay calm and tell them where you are and what is wrong. Or if somebody else is with you, make sure that they're calling for help, okay? If you don't have your phone, you get help any way that you can without delaying CPR. So you might be scooping bub, running outside, flagging down a car, doing whatever you need to do to get help, banging on your neighbour's doors, whatever you need to do, okay? So after sending for help, we are going to clear and open the airway. So look in their mouth. Is there carrots? Is there Lego, vomit, crackers, anything like that? We're going to roll them over, let that drain out, wipe the front of the mouth, roll them back. Next thing we're going to do is we're going to open the airway. So we're going to put a baby in a neutral position. So we're going to move their head until it is nice and straight and lift that chin upwards towards the ceiling. While we are holding this open, we are now going to check for breathing for up to 10 seconds. We are looking, listening, and feeling. We're looking for rise and fall of the tummy. We are listening for air coming out. We are feeling with our cheeks, and we are looking at their colour. And if they have abnormal or absent breathing, they will have a change of colour, and you know what your child's normal colour is, okay? So if they have abnormal or no breathing and they are unconscious, we are starting CPR, okay? So let's start. 2 fingers, just that nipple line, 2 fingers just below on that center of the chest on the hard breastbone. We are going to do 30 to 2. So 1/3 the depth of the chest at a rate of 100 to 120 compressions a minute. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Open the airway. Breathe. Breathe. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Open the airway. Breathe. Breathe. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, and so on. So we keep going, 30 to 2, 30 to 2, 30 to 2, until either professional help arrives and takes over, until Bub becomes conscious, starts to wake up, okay? Unusual that would happen. More likely professional help will come and take over. You are too exhausted to continue. A medical practitioner or a medical doctor declares that CPR needs to be ceased, okay? Or paramedics, so a medical professional, okay? Or a defibrillator tells you to pause, and then it will let you know when to restart, okay? So let's talk about defibrillator for a minute, okay? Automated external defibrillator. So what that is, they're those things that you see in shopping centres, when we're allowed to go to shopping centres, in shopping centres, at train stations, they are in sporting fields, they are everywhere, absolutely everywhere. And you can use them. You do not need to be trained to use an AED. That's really important. I want everybody out there to know that if you came across anyone, so a baby child or an adult who was requiring CPR and there is an AED available, go and get it, okay? So one person is continuing on with CPR because it's an adjunct to CPR. It doesn't replace it, okay? So one person is going ahead and doing compressions, then the other person goes, gets the AED. They come along, open up the lid. In the box, there will be 2 sticky pads, all right? If it's got paediatric pads, I want you to use the paediatric pads. And if it doesn't, then use the adult pads, okay? So you'd have to make sure that the pads don't touch on Bub. I wish I had my AED here with me, but unfortunately my AED is in the office and I'm in lockdown, so I don't have it. So you're just going to have to deal with me talking about it, okay? So you have the 2 sticky pads, look on there. It has a picture that shows you where to put them on Bub, okay? Usually it would be here and here. However, if Bub is little, we don't want those pads touching. We want one here on bare skin And that would be my dog stretching out and moving the camera for me. And one on the back. So we have mine here and here on bare skin. We simply then turn the AED on and listen to its prompts. It will tell you what to do. You don't decide if the person needs a shock. It will decide if the person needs a shock, because what an AED does is it reads the person's heart rhythm. So a heart might be stopped, it might be wobbling around ineffectively, and what it does is it reads that and it goes, oh, hang on a sec, this heart stopped. And it will say, no, shock's not going to help this. You need to do CPR. It will instruct you to do CPR. Or if the heart's electrical signals are all mixed up and it's wobbling around in a really ineffective rhythm, it might go, hang on a sec, yes, this is a rhythm that does need a shock. So what it will say is, hands off patient, shock required, administering shock in 3, 2, 1, and then administers a shock, and then it will tell you to start CPR again. Or if the person's okay, they'll say, no, back off, roll them in the recovery position. And some of the really fancy models will even tell you if you're doing CPR deep enough. So that's just a really condensed version, a little refresher there of CPR for babies. Now, does anybody have any questions? Please just post them in the comments now while we're live, and I will attempt to answer them for you. So just remember, we usually take 90 minutes to actually teach CPR when we do our classes. This is a condensed refresher version. So what I'd love you to do is that if you haven't done a first aid course, enroll in one, whether it's with us, whether it's with another provider. If we're not in your area, we will help find one for you, because that's what it's about. It's about knowing what to do, and that's what's important. That's what we want everybody to know. And so even though we are in lockdown at the moment, there still are ways to learn, and that's why we wanted to do this with you today, okay? And also, we will do, and I've got my other friend here. Oh, okay, who have I got here? Oh, it doesn't have a name. We'll have to name it. So tune in next week with some suggestions for my guy here, because he's one of our new ones and he needs a name, because we've got about, I don't know, 150 or so of these mannequins, and they've all got names apart from the ones that have just arrived. So he needs a name. Help me out, okay? In the comments below next week, while you're watching CPR for children aged 1 to 8 years, come up with some great names for him, okay? So he must have 3 other in his packet as well that don't have names, so we'll need a few, okay? So thank you so much for joining me today. I hope that has been a good refresher, even with the dog interrupting everything. And I hope to see you all soon. Okay, bye everyone.